Now I would love to transition us to our data presentation titled Presence, Caring, Strength by the Numbers. With this, I'd love to introduce our presenters, Delisa, Monica, and Helen. Delisa Culver is the Manager of Data and Evaluation who oversees LABBN's database development, reporting, and continuous quality improvement efforts across a network of home visiting agencies. And then we will have Monica Charles, which is our Senior Data Analyst at LABBN. Through her graduate studies and professional experience, she combines expertise in process improvement, quality assurance, and data analytics with a commitment to improving health outcomes in the underserved populations. And lastly, we'll be having Helen Chan, which is our data analyst at LABBN. She is passionate about supporting the community one step at a time, whether through people or animals. So please join me in welcoming our speakers, and I will go ahead and share the presentation.
Great, thank you. Welcome, everyone. It's great to see your faces this time around. And so welcome to the data presentation titled Presence, Caring, and Strength by the Numbers. And we are celebrating the impact of presence, care, and connection across our network. The next slide. And before we dive into the data, we'd like to pause for a moment and hear from you. As we move into the numbers, let's remember that behind every data point is a family, a relationship, and a story. Data helps understand impact, but it doesn't fully capture everything that you bring to families and communities every day. So we like to start with a simple question. In one word or short phrase, what is something you give families or communities that data alone cannot measure? And you know, we love a good Mentimeter, so we'll get that up in just a second.
I'm already seeing in the chat, Delisa, empathy, support, reassurance,
Okay, love
empowerment.
it. Absolutely.
Oh my goodness, more compassion, emotional support, a safe space, listening ear.
Mm-hmm. Okay, I see there is community support. Ooh, active listening. Absolute data cannot measure that. Empathy, connection, compassion, kindness. Absolutely. These are great. Yep, safe space, a listener, empowerment, emotional support. Love it. Keep them coming. These are great. Yeah, it's interesting that many of these responses, it reflects the things that are difficult to measure directly. And yet we know that they are often the foundation for the outcomes that we'll be discussing today. So thank you. Keep them coming, and we will move on in the presentation. So we'll navigate back to the presentation and get into the numbers. So give us a second as we get that presentation back up. Great. So let's get into the numbers. And I want you to just note that Welcome Baby and home visitation, they differ in program duration. And as a result, differences in enrollment, service, participation, and other outcomes are expected and should be interpreted within the context of each program model. Now, starting with data on families served, prenatal enrollments are as follows for this year. Welcome Baby enrolled over 1,200 clients prenatally, and home visitation enrolled nearly 200 clients prenatally. And we haven't reached the end of the fiscal year yet, so all the numbers that we shared today will increase by the end of the month. And we have a few standout sites that we want to acknowledge. These sites have either maintained a high prenatal enrollment rate, increased their rate from the previous year, or improved the number of clients they enrolled prenatally. Those sites are Adventist Health, White Memorial Hospital, Martin Luther King Jr. Hospital, St. Francis Medical Center, St. Mary's Medical Center, Antelope Valley Medical Center, Shields for Families, and the Whole Child. Congratulations to those sites. Quite a few of you are doing great in that area. Next slide. Next, we present data on hospital enrollments. This fiscal year, there were nearly 10,000 clients who enrolled at the hospital. And we have a few standout sites that we want to acknowledge. Again, these sites have either maintained a high hospital enrollment rate, they've increased their rate significantly from the previous year, or improved the number of clients they enrolled at the hospital. And these sites are Adventist Health, White Memorial Hospital, Providence Holy Cross Medical Center, Memorial Care Miller Children's and Women's Hospital, and St. Francis Medical Centers. Congratulations to those sites. The next slide. Now let's look at postpartum enrollments for the home visitation programs. Nearly 800 clients enrolled in home visitation this fiscal year. And we also have a few standout sites that we want to acknowledge for their consistent enrollment efforts and or significantly improving from the previous year. And those sites are Antelope Valley Partners for Health, Children's Institute, Inc., Shields for Families, and the Whole Child. Congratulations to those sites. Next slide. One of the consistent goals across the network has been to improve outreach efforts. During our CQI meetings, sites shared successful ways that they are improving outreach efforts. And I will start off saying that self-referrals and community events are the leading sources for referrals. And this word cloud, it represents the many ways and attributions to successful outreach. And I'll name off just a few. So word of mouth, parent referrals, community partnerships, community events, group connections. And so as you can see, many of these don't happen without relationship building. And though this is not on the slide, I do want to call out Shields for Family, who received over 50 self-referrals this year. And so when asked, what attributes to the success, they share that it's based on word of mouth from families. It's staff engaging with families that they see in buildings and homes or other areas that they're completing home visits. It's community group connections and also walk-ins to the admin office. So they're taking every opportunity to engage families. And this is in alignment with our summit theme around presence and visibility. And many of you are doing this. So I want to commend all of the sites for their efforts in building the relationships in the community to make this happen. Next slide. Now let's look at completed visits. For Welcome Baby, over 26,000 visits were completed this fiscal year, and that is impressive. And we also want to zoom in on specific completed visits. So over 20,000 visits were completed in person. And this is important because this year was particularly challenging due to discomfort with community stressors. And that resulted in some clients showing hesitation to in-person visits. But you all made it happen and pushed through. Another visit category to highlight is the registered nurse visit. Over 6,700 RN visits were completed. And the number of visits in which the partner attended, that came to 5,000. And this is for Welcome Baby. Next slide. So to continue on the partner attendance, I do want to share a couple of stats on partner involvement. The Welcome Baby Partner Involvement Tool, it helps understand not only whether parenting partners are present, but how actively they are engaged in their child's life. So at both the 2 and 9-month visits, approximately 80% of families reported that decisions about their child were made jointly by both parents. Additionally, about 90% reported that parenting partners spoke with their child on 20 to 30 days each month, reflecting consistent engagement and connection during a critical period of early development. Next slide. And let's look at completed visits for home visitation. So over 27,000 visits were completed. Very impressive again. And over 20,000 were completed in person. And over 1,800 visits had a partner in attendance. So this presence and support is especially critical for our families who have greater needs. Now I'll turn it over to Monica for demographic and program impact data.
Thank you, Delisa. This year's client population remains consistent with prior years. 78% of caregivers identify as Hispanic or Latino, 8% as Black or African American, 5% as white, 4% as Asian, and 5% as another race or ethnicity. Families served this year spoke more than 40 languages collectively, including English, Spanish, American Sign Language, and regional dialects from around the world. This reflects the diversity of LA County, where more than half of children have at least one immigrant parent, underscoring how deeply multicultural families are woven into the county's fabric. We also want to acknowledge the staff who work tirelessly to ensure families with unique language needs can fully engage in our programs. One example comes from Emanate Health Welcome Baby, where a parent coach supported a mother who used ASL through a communication app. The family successfully completed 9 months of services, and today their child is learning Spanish, English, and ASL. Next slide. This slide reflects just some of the higher risk circumstances of families who enroll. We are seeing 3% of families living in unstable housing conditions upon enrollment. 5% have experiences with domestic violence. 7% of caregivers come into the program with mental health challenges. And 16% of families are experiencing food insecurity. And these risk factors often coexist, meaning many families experience more than one of these stressors at the same time. We have also unfortunately seen increases in food insecurity over the past few years across all programs, along with ongoing challenges related to housing stability. And while these factors represent a smaller percentage of the families served, this still adds up to hundreds and thousands of families who require closer, more intensive support provided by all three of our network's home visiting models. Next slide. So now we're going to move into talking about program impact. The 6 to 8 week postpartum checkup is a critical touch point for new mothers. This visit plays an important role in prevention and early identification of postpartum health risks, and it is a nationally tracked quality measure for health plans. As shown in the chart, 88% of new mothers in home visitation and 90% in Welcome Baby attended their postpartum checkup this year, reflecting strong performance and an increase across the board from last year. The Medicaid HMO line in the chart is a national comparison group that's similar to the families we serve, which further highlights the network's success. And we also tend to see similar positive trends with well-child visit attendance, and this reflects consistent engagement in preventative care across programs. Next slide. HFA PAT and Welcome Baby continue to do an excellent job with screening for depression and anxiety. This year, over 34,000 depression screenings and over 13,000 anxiety screenings were completed across all models. Look at those numbers for a moment. And to focus in on a key time point, the charts on the right show depression screening rates within 3 months of childbirth. This is a critical window to identify signs of postpartum depression, and our programs consistently excel in screening during this period. And we also want to recognize staff efforts in connecting families to services after a positive screen. This step can be challenging given resource availability and client hesitancy, which underscores the essential support that home visiting programs provide. Next slide. Using the Ages and Stages questionnaire, our programs also continue to screen for developmental delays at high rates, especially when comparing to the state rate. In the past year, 84% of children in home visitation and 99% in Welcome Baby were screened at least once, with over 11,000 total screenings completed across all models. The emphasis our programs place on developmental screening helps ensure that families identify potential delays early on and connect to needed services. And this note from a Child Care Resource Center family really illustrates the program's role in connection to services and ongoing support. Thank you for supporting me to complete the regional services application. My son received early intervention services, and now he is doing great because of your support. You are not just a parent educator for me. You are my friend and part of my family. Next slide. California's childhood immunization rates remain strong overall, but Black, Brown, and lower income families continue to experience lower vaccine confidence and coverage, according to a November 2025 Pew Research Center study. As childhood vaccines receive increased public attention and vaccine hesitancy is more common, coaching and education is especially important for the families we serve. Our network's high self-reported immunization rates, 90% at 12 months for home visitation and 97% at 9 months for Welcome Baby, reflect the value of the trusted guidance that home visitors provide to families. And now I'm going to pass it over to Helen to talk more about program impact.
Next slide, Faith. Thanks, Monica. This year, there are over 18,600 community referrals made. Community referrals are important for families as they connect them to trusted resources, support networks, and essential services that help support their journey. The top 4 categories that have the most referrals includes charitable services, parent or education group, food needs, and lactation support. Next slide. Additionally, this year we're seeing increases in different referral categories. There is over a 10% increase in WIC-related referrals and over 30% for intimate partner violence, food bank, dental care, and Head Start/Early Head Start. This aligns with what we're seeing in the family demographics data that Monica shared. I'm happy to see that the network is working tirelessly to provide resources to uplift our family. Next slide. Next, I want to talk about client goals. Client goals are a vital part of the home visitation program. Home visitors work with clients to create a plan to achieve their goals. This year, we had over 1,800 goals completed and over 3,300 goals started. There is no stopping the families in this network. The top 5 goal categories this year were infant-toddler development, education, child health, medical and dental care, basic essentials, and employment. Next slide. I want to share a quick snippet of a story from Shields for Families. A first-time Spanish-speaking mother entered the program experiencing postpartum depression and criticism from her in-laws about her parenting. With support from the program, she accessed mental health services, established boundaries, and enrolled in ESL classes at a community college. Her dedication and enthusiasm led to a part-time teacher assistant opportunity. Throughout her journey, she received comprehensive support, including childcare, food, diapers, household essentials, self-care items, and a car seat. During a recent home visit, the client expressed her gratitude, saying, "If nobody has ever thanked you, I want you to know that I'm grateful for all that you do. You have helped me through my depression and anxiety and teaching me to understand services around me that I did not know about." This really shows how much strength there is to the presence and care our home visitors provide to the families we serve. Next slide. This year, we had over 170 families graduate in the home visitation program. On average, families were enrolled for a little over 19 months, and we have over 570 families who have been enrolled for over 2 years. I want to take a moment to highlight some sites that stood out. These sites had the highest number of graduates at their site and or retained their families for over 19 months. These include Human Services Association, El Nido Family Center, Shields for Family, Child Care Resource Center, and Foothill Family Services. I'm loving the love I see on the Zoom. Next slide, please. Now let's move on to Welcome Baby. This year, there are over 5,400 Welcome Baby graduates. Out of those 5,400 families, a little over 2,900 were in the Welcome Baby Light program, and roughly 2,400 were in the Welcome Baby Full program. Now let's shout out some of our rockstar sites. These sites have shown an increase or improvement in their completion rate and their graduation counts compared to last year. These sites include Adventist Health White Memorial Hospital, California Hospital Medical Center, St. Mary's Medical Center, and Memorial Care Miller Children and Women's Hospital. Next slide, please. As we wrap up today's presentation, we want to thank each of you for your dedication and hard work throughout the year. We've celebrated many milestones together, from Home Visiting Day to proclamations and other special achievements. None of the successes or data shared today would be possible without your efforts. Take a moment to recognize your accomplishments and give yourself a pat on the back. Thank you for all that you do to support families and strengthen our communities. Thank you.
Thank you, data team.
With that, I would like to introduce the second self-care video that we will be watching today.
And now, a self-care spotlight.
Such a great video, Brenda. Thank you so much for sharing that with us. And we will go ahead and also watch our third self-care video of the day.
And now, a self-care spotlight.
Cheers.
Thank you, Fatima, for sharing that video. I bet we can all relate to that one. We all need a coffee in the morning to get us going.